Hello. I hope you had a wonderful holiday with your family and friends and were able to enjoy the time. For many, I'm sure it was tremendously stressful. Worried about COVID, lots of phone calls back and forth. I know at my house this weekend, test results, COVID, who has it, who doesn't have it, who do we keep socially distanced, all of those things. And that just adds a layer to what already is an anxiety in the community. We have seen our numbers quadruple within the hospital since November. Actually 4 times what they were running in November. The thing that was most startling for me is not only the total number of patients, which certainly has gone up, but the number of people who are on ventilators who have COVID. The Department of Health has indicated that our numbers in New Jersey will continue to rise post-Christmas and Kwanzaa, and we should see our peak as we run our predictive model here at Inspira hit highest in February. That's probably another 100 patients than we have right today. And what that does is just stress the heck out of the system. So I'm asking you to be careful, just like the same message that we've had all along. Wash your hands, remain socially distanced, really be vigilant about masking up and knowing who's in your bubble. The experts have weighed in, and the monoclonal infusion that we've been using for the Delta variant is not effective in the Omicron, and that is the largest percentage of people who now have COVID-19 get it through the Omicron variant. And so therefore, the experts have pulled the drug from our ability to give infusions. There is a specific drug that can be available, but it's in very short supply right now, and there are very limited conditions. You must have a physician referral in order to get it. We have a limited supply, and we are anxiously awaiting news, which obviously I will provide with you in coming weeks as to when we will receive it. So the reality is the best thing for us to do is really focus on all of the preventive measures. Vaccines, boosters, washing your hands, wearing your mask, and making sure you're remaining socially distant. So obviously all of this, as I've mentioned, puts tremendous strains on the system. Our visitation is red. Here are the conditions where a visitor will be permitted. Obviously they are limited, and I know that even causes yet another layer of stress for both you as well as our staff who are trying to respond to your calls and concerns about your loved ones. We are doing our best to make sure that we can provide all that information, but I just ask for your patience as we try and work through these very challenging times. I'm thrilled to tell you that on December 27th in Mullica Hill, we were authorized by the Department of Health to begin to provide elective angioplasty services. This is the cardiac stent procedure. This is for those individuals who are not in crisis situation but do have a need to have a cath. We're thrilled to be able to do this in Mullica Hill. We have some renovations to make in Vineland and expect to have those done quickly and then be able to provide that procedure there as well. Our cardiac program is something we're very proud of. Cardiac Partners is something that we established with Cooper Medical Center, and obviously our relationship with Heart House in Vineland. So great news for all of us, and please wait and I'll tell you more about it in the coming weeks ahead. But we are thrilled to provide this service to our community. I would like to share with you a patient story that I think really represents a lot of what people are going through right now. See, Chuck Pellegrini knew that his daughter's wedding was coming up. And while he had a need for an ankle replacement for some time, he was so worried about what would happen with that procedure, whether or not he'd actually be able to walk his daughter down the aisle by the time he had the procedure. He was trying to delay the procedure. So Chuck reached out to Dr. McAndrew and his team there and really shared with him some of his concerns. And Dr. McAndrew, as well as Adrian Sindoni, credited by Chuck for really providing him not only the clinical expertise, but the support that he needed to address his anxiety over all of this situation. I'm thrilled to tell you that Chuck did walk his daughter down the aisle and dance with her and have a very successful treatment. And we are thrilled to be able to be that partner. Now, especially with COVID and everything going on, people are delaying coming in for care. And what we know is those delays often create challenges. So what I really want to do is thank Chuck for giving us the trust to be able to wrap ourselves around him and be able to help him fulfill something that was so important to he and his family. A lot going on. I want to wish you a very happy new year and a healthy one. And until we meet again, be well and stay safe.